COVID-19 treatments explored from vaccines to antivirals. Treatments. Monoclonal antibodies. Monoclonal antibodies are a type of immunotherapy that can be used to treat COVID-19. They work by binding to the spike protein of the SARS-CoV-2 virus, preventing it from entering cells. There are several different monoclonal antibodies that have been approved for use in the United States, including bamlanivimab, etesevimab, casirivimab, imdivimab, and sotrovimab. Remdesivir. Remdesivir is an antiviral drug that was originally developed to treat Ebola virus disease. It has been shown to be effective in reducing the severity of COVID-19, and it is currently one of the most widely used treatments for the disease. Dexamethasone. Dexamethasone is a corticosteroid that can be used to treat inflammation. It has been shown to be effective in reducing the risk of death in hospitalized patients with COVID-19. Other treatments. There are a number of other treatments that have been studied for COVID-19, but there is not enough evidence to support their use at this time. These treatments include hydroxychloroquine, azithromycin, and convalescent plasma. Vaccines. Pfizer-BioNTech COVID-19 vaccine. The Pfizer-BioNTech COVID-19 vaccine is a 2-dose vaccine that is administered intramuscularly. It is 95% effective at preventing symptomatic COVID-19, and it is also effective at preventing hospitalization and death. Moderna COVID-19 vaccine. The Moderna COVID-19 vaccine is also a 2-dose vaccine that is administered intramuscularly. It is 94.1% effective at preventing symptomatic COVID-19, and it is also effective at preventing hospitalization and death. Johnson & Johnson COVID-19 vaccine. The Johnson & Johnson COVID-19 vaccine is a single-dose vaccine that is administered intramuscularly. It is 66.3% effective at preventing symptomatic COVID-19, and it is also effective at preventing hospitalization and death. These are just a few of the treatments and vaccines that have been shown to be effective against COVID-19. It is important to note that the effectiveness of these treatments and vaccines can vary depending on the individual patient. It is always best to speak with a healthcare provider about the best treatment options for you. In the battle against COVID-19, 2 drugs have emerged as powerful tools: remdesivir for inpatients and Paxlovid for outpatients. Let's take a closer look at how they are used. Remdesivir, an antiviral drug administered intravenously, is typically given for 5 days and is most effective early in the infection. It's usually recommended for hospitalized patients showing symptoms like hypoxia, a need for supplemental oxygen, or mechanical ventilation. It can also be used in severe cases like multisystem inflammatory syndrome in children, acute respiratory distress syndrome, and patients with underlying conditions like diabetes or heart disease. It's generally not recommended for patients with mild or moderate COVID-19. Like any medication, remdesivir can cause side effects, such as nausea, vomiting, and diarrhea. In rare cases, it can cause kidney or liver problems. If you're hospitalized with COVID-19, your healthcare provider will discuss the risks and benefits of remdesivir. On the other hand, Paxlovid is an oral antiviral medication for outpatients at high risk of severe disease. It's most effective when started within 5 days of symptom onset. You must be 18 or older, have mild to moderate COVID-19, and be at high risk of developing severe disease to be eligible for Paxlovid. This includes unvaccinated individuals, those who are immunocompromised, over the age of 65, or have certain underlying conditions. However, there are some contraindications. If you're allergic to nirmatrelvir or ritonavir, or taking certain medications that can interact with Paxlovid, including some statins, HIV medications, antifungals, seizure medications, or cancer drugs, you should consult your doctor before taking Paxlovid. Paxlovid can cause side effects like nausea, vomiting, diarrhea, headache, fatigue, muscle pain, back pain, decreased appetite, and various respiratory symptoms, among others. If you experience any of these, you should contact your healthcare provider. And remember, if you're pregnant or breastfeeding, it's important to consult with your healthcare provider before taking Paxlovid. However, Paxlovid can interact with several other medications, some of which are St. John's wort, rifampin, certain statins, HIV medications, antifungal medications, seizure medications, and cancer drugs. These interactions can be serious, so always consult your healthcare provider before starting Paxlovid. Not only medications, but certain foods and supplements can interact with Paxlovid too, such as grapefruit juice, ginseng, St. John's wort, and certain dietary supplements. Interactions can be managed and potential risks mitigated with the help of your healthcare provider. Always disclose all the medications, supplements, and significant dietary habits to your doctor before starting Paxlovid. Paxlovid and remdesivir are powerful tools in our COVID-19 treatment arsenal. The quest for a universal COVID-19 vaccine. As we continue to grapple with COVID-19 and its variants, there's a question on everyone's mind: is there a universal COVID-19 vaccine? As of now, the answer is no, but scientists worldwide are working tirelessly to create one. One promising approach involves targeting the nucleocapsid protein, located inside the virus. This protein is less prone to mutation, which could make a vaccine targeting it more effective against future virus variants. Another approach is a multi-target vaccine, which would aim at multiple proteins of the virus. This approach could create a stronger line of defense, making it harder for the virus to mutate and evade our immune system. While it's too early to predict when a universal COVID-19 vaccine might be available, the current progress is promising, and science continues to forge ahead in this race against the virus. As the scientific community works on this significant development, it's more important than ever to stay informed and vaccinated.